Welcome to Habitual Excellence, presented by Value Capture. This podcast and our firm is all about helping you and your organization achieve habitual excellence via one unifying focus, one value-based structure, and one performance system. In other words, it's about helping you capture dramatically more value through achieving perfect care and perfect safety for patients and staff. To learn more about Value Capture and our services, visit www.valuecapturellc.com.
Hi, listeners. Welcome to a very special edition of Habitual Excellence. This is the podcast where we get to talk to leaders who live and breathe the principles of organizational and operational excellence and what we call habitual excellence, and have track records of producing incredible things for patients, populations, and institutions by following those principles. And today, Value Capture is looking back at 20 years of real gratitude for serving healthcare leaders and all that we've learned, and the privilege of supporting some of North America's great healthcare leaders to produce sustainable, important results. But we're especially looking forward to the next 20 years of doing the same thing. And we have a very special guest to help us do that this time. It is our very own Shana Padgett, who 2 weeks ago took over for me as the CEO of Value Capture. She has been with Value Capture for 9 years and most recently was a vice president of operations. And for those of you that don't know Shana already, you're in for a treat. Those that do are really excited about her taking over the next generation of leadership of the firm, and those that don't are going to be very excited as soon as they meet you. So Shana, welcome to the pod.
Thank you, Ken. Long-time listener, first-time caller. Is that how I'm going to weigh in?
I guess that's part of the vernacular. So yeah. Well, thank you for being a listener and someone who's not only learned but also helped us learn how to communicate ideas of the leaders that we've served and learned so much from over the years. Shana, will you introduce yourself? And for those that don't know your background, that sort of brought you to Value Capture and brought you to this seat, fill them in a little bit.
Well, Ken, thank you for having me on today. I'm really excited about this conversation. But for those who don't know me, I come out of the lab. So once upon a time, I was a clinical laboratory scientist. That's the work I did part-time when I was in college, graduated right into leadership in that role, and immediately got to learn a lot. Yeah, it was an interesting time, but I worked in the lab for a long time. We moved. That afforded me the opportunity to spend some time teaching. So I spent 5 years in higher ed, preparing associate degree folks for healthcare, and then went back to the lab. And that is how I tripped into this career. So I was in the lab, would do all kinds of fun projects. My kids were of an age where I could do projects. And so I volunteered to be on a lean team. Didn't know what that was, but sounded like fun. So I got involved and learned about continuous improvement, that it was actually science and a methodology. And there was a whole lot more to it than just what I'd been doing my entire career, sort of organizing my space, learning how to organize systems. So that was actually really fun, and it changed my life. It changed how I thought about my work, changed how I thought I could contribute to healthcare, and certainly changed the kind of people I got to meet and ways we got to interact. And so I did consulting with Johnson & Johnson for about 6 or 7 years, and that's where I really got to learn about this. And then I went back inside for a while, did all kinds of improvement in operations, internal to an organization. And then I heard about this group. A friend of mine who I used to work with at Johnson & Johnson was working for this company called Value Capture. And Megan said, I want you to meet these guys. And so I did. And I tell you, the reason I came to value capture was because we had an approach, you guys had an approach that I didn't know about yet. That is, it was different than the way I was taught. It was different than the way I learned lean in healthcare. And I was intrigued and wanted to know more. And so I jumped on board, kind of thinking I was going to tell you guys you were doing it wrong. When in fact, I learned all kinds of things that changed my own practice and beliefs and the way I think about lean in healthcare now.
Well, thanks for sharing some of that. And if folks didn't catch it, you really served as a health system leader, with these ideas, and as well as a successful coach of many through your different trusted advisory roles. And you highlighted something, which is that you do think differently about things. And it's interesting that you were attracted that we think a little bit differently about things. So, in your 9 years at Value Capture, um, you know, coaching leaders and helping us evolve how we support leaders, what is it about our approach that has been a good fit for someone who thinks differently, and especially the results you're seeing, come from, our partners?
So I am going to answer the question, but the reason I get up in the morning, so everybody has their personal mission, right? But I think healthcare is a right, not a privilege. And I think we can figure it out. I don't think it has to be rationed. I don't think it has to be inaccessible. I don't think we need inequitable outcomes. I just don't believe that. I have met too many smart people that are just too dedicated to their practice and to their patients. So I think that we as healthcare leaders and practitioners can get underneath the hood and fix the problem, and that we can make high quality, affordable healthcare a human right. And so that's why I do what I do. And it affects how I think about improvement. So that's why I'm sharing that. And that's why I was so excited about improvement science when I got introduced to it, because I realized we can do more, right? I can do more than just my workstation or my team or my organization. There's more we can do. And what I learned is there are ways that create short-term value, and there are approaches that can create long-term value. And that is something that I learned through my early days of practice. And I think we all did in healthcare, right? We really got excited about 5S'ing or value stream mapping or different kinds of tools. And we made amazing changes, right? We made things so much better. We made ED turnaround times and throughput, and you can get your lab results on time, and we brought down harms, avoidable harms to patients and to employees. We did lots of things. We didn't always sustain those things. So why value capture? I didn't ever lose belief that we in healthcare can figure it out. And I think that the principles that have been being applied across sectors and centuries to make work more meaningful, more efficient, more effective, I just don't think they're wrong. I think we haven't figured out how to do it well yet. And what was happening in value capture is you guys were focusing first and foremost on safety, on patient safety, on employee safety. This idea that if you could figure out how to keep people safe while they were in treatment, while you were at work, if you can figure that out, then you have solved so many of the problems that create all the other problems, all the wastes, all the inequities, all the lack of accessibility, all the untoward costs. So it was just, I don't know, it was a another one of those pivotal moments for me. Pick that one point of leverage and solve for those instances every time they happen, right? You don't need to sum them up for 30 days and do a Pareto and do some root cause analysis. Every time you have that risk or harm, you go and solve. And if you solve the root, you're going to solve the problems that you need to solve for everything you're trying to achieve in the organization. So that was mind-blowing for me. Never heard it until I met you guys. And I'm like, huh, that seems interesting. I'd like to know more.
Well, and it's a great point to just note how challenging, but how gratifying it's been to bring that approach, continuously improved, to leaders who recognize that power of a leverage point around, something that matters in a fundamental sense, values wise, but also in terms of creating the ability to improve and be agile every day in a way that connects people more deeply to each other and to the mission and to excellence. And I think we just want to tip our hat at this point to all those leaders and people that we've had a chance to suit up right next to and share our fresh eyes and experience with, but also learn just as much from for more than a couple decades now, who have made great things happen with that approach. And as we reach 20 years, I know for me, there are more and more times when an echo of early work or just previous work comes back in terms of the impact that thinking has made to build, more sustainable improvements and work environments where people feel valued and that they can be successful. And many of the previous guests on this podcast are those leaders that have done that. And I love how you said you've never lost faith in doing that.
So Ken, I'd like to ask you a question.
Okay, yeah, we're turning the tables on this podcast, so we get to go back and forth here.
Well, you're alluding to it a little bit, those echoes and those leaders that you've interviewed and that I've listened to their podcasts. Even when I know them, I love listening to them on the podcast, right? Just different insights, different depths. So that's just, I enjoy that. But talk a little bit about where those echoes are coming from, those first formative years. I mean, I wasn't there for them, so I'd love to hear more.
Well, when you look back to our early story, a lot of stuff that is still true was true then. And it's an environment that is very complex. Healthcare, is just as complex as it ever was. It's only gotten more complex, but it was certainly still complex then. Payment models were in flux, as they always are. They're in flux on hyperdrive now. And healthcare was at a period where it was, I would say, less and less satisfying to be a caregiver and in some senses a leader. And healthcare was also coming up to face with some evidence that was being pulled together that the job we were doing in aggregate in terms of providing not just for the health of the population, where we know the US lags, but also the safety of those patients that we care for and some of their clinical outcomes was short of what we knew was possible and what happened usually. But there were far too many things going wrong, in terms of infections and things like that. And so it actually was a point where the leverage point came into view for more people. And the chance to partner with those that said, look, I don't know how we're going to do it, but I implicitly sense in my soul that the right goal for harm that occurs to somebody who comes to us with care is 0, and the right goal for harm for somebody who works for us is 0. And that if we can figure that out with some new techniques and new ways of thinking, that good things are bound to spread across everything that we do. And so those early years were marked by really exciting efforts with leaders who, again, were dissatisfied with the status quo and had the courage, I think, to set out on a new course. It was also marked by lots of challenges, by lots of places where the complexity, seemed to overwhelm, and people got distracted. Also, where the natural conservatism of healthcare, when business formulas get tweaked, finance formulas get tweaked, et cetera, sort of took over, where leadership successions, sometimes the sort of the highly sensitive habitual excellence operating system that gets created when you get this stuff really rolling, it depends on generational succession of leaders carrying it forward and the board's involvement in that. So in the areas where it was hard and where some of these things tripped up, we were also learning, and learning with the sector about what it takes to really drive sustained change for the better, even as the forces outside were continuing to buffet us. And so, like, you've never given up hope. I think those of us that have been in this work, our customers and ourselves, have also never given up hope, even when it was hard, and are, again, very proud of the building blocks that were created in those early years. But know that to have the impact collectively we know is possible for healthcare, and to grow a core strength that we know needs to be deeply nurtured now, we've got to sort of take it to the next level. Um, and I'm going to turn it back to you at this point, because to me, you're a next level leader. And for those of you that don't know, I'm one of the founders of Value Capture 20 years ago, and was the founding director of the Pittsburgh Regional Healthcare Initiative before that, where a lot of these ideas got demonstrated. And 2 weeks ago, I did hand off in a planned generational succession the CEO role to Shana. And Shana, one of the reasons that I think you're really an outstanding lead advisor, if you will, in the CEO role for Value Capture for the sector, is that you come from a perspective of always deep sympathy, I think, of looking at what leaders are facing and listening deeply to them and understanding where they want to go, both in an ideal state and target state, and never in an ideological or any other way imposing something that's about us, but supporting them. And I want to ask you, because it is a time of great change, you're in touch with a lot of healthcare CEOs and C-suite members. What are you hearing from them these days? What are you seeing recently? And how is it informing how you're going to lead Value Capture in the future and innovations in our own ability to support them?
Well, it certainly is a time of unrest and upheaval. And I don't need to go into it. Everybody who's listening understands what's going on. They're living it every day. And you said something when you were talking about those early days while you guys were learning. You talked about distracted. And I have to tell you, the leaders that are open to these discussions and want to explore things and bounce ideas and really learn together. I mean, those are many of the conversations that I'm in. And then when we're working with clients, leaders that have specific goals and plans they're trying to get to. So both of these types of leaders are working to not become distracted on their own. And what do they need to do to help their teams stay focused on the value, on the mission, on the vision, even as the world continues to spin and swirl around, right? So we thought the pandemic, was a problem, and it was. And then, we thought, well, okay, well, that'll be better. And then we had the whole post-pandemic with all of the shifting of people's priorities and retirements and not enough folks to work, and just changes in healthcare all the way around that I don't think could have been predicted. But we'll get through that, and then it's going to be fine. No, then the payer model, and now we have a new administration that's thinking differently about some fundamental payment models that come to the hospitals and the clinics, right? So when you talk about Medicaid and Medicare, that's a payment model for every organization we work with. And so these things are all true, and the mission and the vision and the focus stays the same. Right. And so back to what is the way that leaders that are able to stay focused and stay thoughtful and believe that there is a way. So when I said I believe before, these leaders that I'm talking about and talking to, they believe there is a way that will get you more sustained results, right? Anybody can get results for the next quarter. Can anybody get results? Can everybody get results for the next year, next 5 years, next 10 years? And I really think that's how those leaders, I'm thinking about a children's hospital leader, right? Thinking about the way. It's not just continuous improvement. We've got to solve problems all day, every day, big, small. So let's use a disciplined, focused, proven way to solve a problem. And always focus on diversity, equity, and inclusion, right? So for him, these things go together. That is the way. Not only do we solve the problem, but we solve the problem with a lens on equity and including the right people and all the people, right? And so it's just an amazing way to enhance continuous improvement thinking, but that's the way. And he stays focused no matter what the swirl is. So that ability to avoid that distraction. Or, we've got some amazing leaders that are bringing organizations that primarily do safety net work, right? So they take care of those under and uninsured folks. That's their mission and their vision. And so again, how do you stay focused? How do you stay mission driven when you're not sure if your entire payment model might have to change? Rather than, retracting and thinking, okay, well, what are we going to have to cut? Who are we going to have to let go? What are we going to have to close, right? Rather than that sort of scarcity mindset, they're leaning in. You know what? We're going to have to solve the problem today, tomorrow, someday. We should solve it now, and we should solve it to root, and we should solve it so that we can continue to take care of our patients and our people. Same methodology that you guys were using when you were chasing down the harms, that in those early days, formulating it, it's not just the methodology to solve the problem, but it's the methodology to think about the problem and to organize the people that do the work and to change the way you lead so that you can not stay head down, but stay eyes forward. And so I think that's where we have to think about changing our model, not the tools, not the techniques, not the principles. Those don't need to be redefined. But how do we meet the challenges of healthcare today? And how do we solve the actual problem? The real problem with healthcare, as far as I'm concerned, is not throughput and ED times. It is, why are you sick to start with? Right? Why do we have certain chronic diseases? Why don't folks know about options they have? Why don't people have access to good food, better air? And I'm not trying to boil the ocean. And if you really want to fix the problems in healthcare, let's make people healthier. And then when you need preventative care, when you have an acute issue, when you do have things that go wrong, of course, we need the flow and the quality there too. But I just think we need to focus on the real problems and the real roots and be less distracted by the payer model.
Yeah.
It
Shana,
doesn't matter. It doesn't matter if the payer model changes. People are still sick. People still need cares. People still need to deliver value.
Well, thanks for that answer. And I think as you started to put together the ideas there, people got a sense for the power of your systems thinking and the practicality. And just to highlight a couple things, you talked about one client um, as an example of the staying focused, and we're hearing from many that even though the pace of disruption is greater, they've realized that they really just have to double down on creating agile, operating systems every day that can allow them to stay true to their mission, as you said, while, in a really disciplined way, achieving goals, with their care teams and staying aligned and flexible and agile. And they just sort of, as the change happens, they just sort of point it, at what they have to do. And that's been great to see. And the results coming and the hundreds of millions of dollars and improving days cash on hand together with the quality and the safety. And, you and I both see lots of institutions that are still in the grips of the cutting mode as they're faced with challenges. But it is gratifying to see a larger percentage of leaders, I think, going to build capacity instead of potentially harm it as we go forward. And for that reason, I think picking up from your answer, it's actually an exciting time, right? Because the business model was bubblegum together for a long time. And if we can think expansively and from the perspective that people in healthcare really want to do great things and they want to do great things in an aligned way together, and we can sort of start to think about things differently, but from that common base that we share, a lot of really cool things are not only possible, but beginning to be demonstrated by those that stay focused, as you said. So, um, and your energy for that, I think, is a big reason why it's so exciting to have you move into the CEO suite for us. Shanna, earlier you were talking about client results and how through your own coaching, but also helping the firm help leaders get them more consistently. One of the real insights you've had is how people think about the collective enterprise at a very broad level, but a very practical level, and that's culture. Could you talk a little bit about some of your insights there and how you've helped leaders take a hold of that in a way that produces the lasting change that you want?
I think it's really important, Ken, and I actually think that's the differentiator. The people that take the opportunity to reinforce what's working well and solve for the things that aren't working well. Think about it through the lens of the culture of the organization. How do we become a learning organization or have a culture of continuous improvement? You'll hear that a lot in those leaders that are leading differently and getting those sustainable results, no matter what the fastballs are that are coming at them. And I was just thinking about, Shingo teaches us a lot about culture and how to define it. But I think that the leaders that really succeed leverage the operating system, right? So that's what we help them put into place. And you don't have to call it that, and nobody needs to get stressed out about it. But it is an operating system about how you run any business, right? And so the leaders that truly understand this, who believe that the way is to engage every person in the organization, everywhere in the organization, every day, to make the work more meaningful, more efficient, more safe, but more meaningful, right? Engaging everybody, everywhere, every day, using a scientific approach to solving for the gaps in whatever it is they're doing. Those are the leaders that are going after culture, not just after the results. And what they find out is if you design for your culture, you will not only get the results, but you will get them sustainably over time. You'll get results you didn't realize, right? We solve for inpatient flow and patient days, and what you get are, amazing decreases in hacks or in nursing turnover, right? So there are echoes of doing the right thing the right way with everybody involved that go far beyond those initial results, go far beyond the top line or the bottom line, right? They go for for the sustainable future all across all kinds of dimensions.
Yeah, I think that's a great example of how but value capture as a whole, how we try to take what can be pretty amorphous concepts such as culture, but are really important because people care about their people and they understand it's the people of the organization and what they do that produces the track record over time. And show leaders how to focus on that super practically and through things that build momentum and leverage, in a way that sustains and is how you run the place every day. So that practical operating system view that allows them to take the amorphous idea of a culture, but that matters to them, and really see it get better and have it in scope the whole time, even as they're just working on particular results. But it's all to build the culture that can keep getting those results. So it's
It is amazing. I think it's amazing to focus on an operating system and realize, oh, that's our leadership development system as well.
right,
That's
right,
our strategy deployment system as well. That's our respond to the surge, every fall, every winter
yeah,
with the respiratory surge. Like that's your
right,
system that you
right,
can use for everything. And it was proven during the pandemic. The systems that had the organizations that had their operating system operational fared better. Proven,
yep,
proven. Um, so
yeah,
anyway,
great,
that's how you get it.
great call, and it's such exciting and gratifying work, and it speaks to sustainability and scale of results too.
And it's an honor, and it's also a test. It's a little bit scary to be the first non-founder CEO for Value Capture. And I am really so pleased to have this opportunity to be part of. You talked about people that have made great progress and saw it just wash away because they didn't think about generational
Hmm.
sustainability. They didn't have a succession plan. They didn't include the board or the owners.
Yeah,
And it's no judgment, it's learning, right?
right,
So learn from everything that goes wrong. That is a core principle that we lead with: learn from things gone wrong. You
yeah.
need to learn from things gone right, but you need to solve for the things gone wrong. And I feel like I am part of that learning that the founders that you guys took away from not thinking forward about the future. So I don't know anybody who steps down as a CEO, lets the VP stand in, come up to the CEO, and then you stay on to make sure that I have what I need, the team has what they need. We still have problems we need to solve for our clients and for ourselves. And so you're staying on. Who does that, Ken? Why would you do something like that? That's not very common.
Uh, well, you're being kind, and there are some other people who've said that to me, that it's not very common to see this happen. And I think actually that's an opportunity for all of us to reflect on leadership, right? And sort of leadership of North American institutions and healthcare institutions right now, because it's not strange for us, right, at Value Capture. And for those that don't know, the leadership role has rotated among the founders since our founding. I've had a long stretch here, but Paul O'Neill Jr. and Jeff Webster led, and we had Paul O'Neill Sr. as our non-executive chairman while he was still with us and inspiring us and teaching us. Um, but at the same time, trying to be evidence driven about what makes the change for the long term. you know, uh, Trusted advisory, mission focused firms like us, no matter how good we are and we think we have the best, most firms like ours don't make it past the generation of the founders if they think of themselves in a pure sort of corporate sense. And there are a lot of reasons for that. But of course, we went to school on that, and we believe that the mission is what matters. And so while that has made us really particular about the partnerships that we choose and the desire to not just join someone else's much larger sort of P&L sheet, through a merger or something, that at the same time we needed to recognize that you've got to build for generational sustainability, and that means at some point that the next generation needs to take over. And so as you know, we've been working on this for a long time, and it seems very natural to us, because I think the legacy we all want to see is an expanding impact of the mission and the ideas that we stand for. And that, as you said, we know work in healthcare. And so our job has been to identify and, you could say develop the best and the brightest, but also learn from the best and the brightest. And when they're ready, get out of their way. And, I very much and the other partners wanted to make sure, and you're a partner now, really wanted to make sure that this happened while we were still around and could help make sure it was successful, instead of handing over and hoping when we had to. So I know for me, I'm delighted. And it's, I think it's really natural when you think about long-term mission impact and legacy in those terms, and when you think about leadership as kind of lead partnership, if you will. So that's where all of that came from, and why it seems natural to us. And I hope if it's a positive thing, it's part of the learning conversation that we have with our customers. And there've been some great conversations already. So.
And I'm really excited about the future. And I am excited not for the pain and the disruption and the fear that is swirling around, right, amongst our colleagues, our connections, our clients. And I am excited that we believe that we can solve the problem to root in a sustainable way, focused on values and creating value, and not cut our way to the. I don't want to take a shortcut, and that's so many of the leaders we work with are also not looking for the shortcut. I understand that sometimes you have to make hard decisions. We've had to make hard decisions. Sometimes you have to make hard decisions, but there are no shortcuts to sustainable value. And so this is not a criticism of anyone. It's just, that's not our model. That's not what we teach. That's not who comes to us. And in fact, lots of people come to us when they've not realized that they were being, sold the shortcut, and then it didn't get them where they needed to go. And to be able to help folks that are ready for that deeper, sustained approach. I'm excited about the future, and it is now, right? So you said it, the model has been bubblegum together for as long as I've understood the model, right?
Yeah.
It's always been something, and it's been bubblegum together, and it never changes the fact that there are people who care deeply about their mission, their vision, their patients, bringing their practice to bear. Those great, amazing people are still there doing the work every day, being led by folks that are trying so hard to make it work and make it last and make it easier for people to take care of their community. It's a good time. It's a good time to just, let's dig in, let's get under it. It's already a mess. Let's just get down to what the root causes are and start hacking away at the mess.
And if I can brag on us for a little bit, I think, again, but it's in combination with our customers who've been the actual ones with the pickaxes. We've really figured out how help not just with the right ideas, but how to sort of build the practical operating systems that allow that success while staying focused on the mission to happen, and just real practical, get it going so that the results come fast without shortcuts, as you're learning, and then they expand from there. And I'm proud of how our ability to support has simplified in a sense over the years, has stayed simple where it needed to be, and adapted to the times. And together our models of how we support leaders, wherever they are, and to fit. So, Shana, I'm guessing that if people want to talk to you and get to know you better, healthcare leaders, they can do that. Is that right? Should they reach out to you?
Of course, Ken. Always, always.
And to do that, to get in touch with Shana, you can reach her, if you check out her bio on our website, valuecapturellc.com, you'll see her contact information there. Also, feel free to reach out to me always, and also through my bio on the website. For leaders who are interested in exploring a little bit more about these ideas and sort of the leadership angle on them, because if you haven't picked it up by now, we believe the framework that the leaders have and drive is sort of essential to producing sustainable good. And there's a lot of resources on our website. We hope you'll become, if this is the first time you're listening, a subscriber to the podcast on whatever platform you have. So remember to hit like, however you're listening to this, and subscribe if you haven't already. And, most of all, we look forward to the next 20 years of supporting the sector with the vision that Shana's outlined, and to doing it in continually innovative ways and continually optimistic ways that produce the results you need. So, Shana, thanks for saying yes, and becoming the CEO that will lead us into the next 20 years. I know how proud we are of the first 20, and how excited we are for the second 20. So we'll leave the final word to you. What would you like to say to our partners out there?
So it's a saying, right? The best time to plant a tree was 20 years ago, and the second best time to plant it is now. And you guys planted one 20 years ago, and now it's time to plant another tree that can help us move into the future. And so I'm excited, and I am honored, and I believe.
Great. Well, we believe and we know it works, and the partnerships are exciting, and they give meaning to our lives, I know, professionally and personally. So thanks for taking the handoff. You're a faster runner already. Good things are ahead. Good things are already happening for Value Capture, and certainly for our customers. Thanks for being our guest, and listeners, we're so glad you were with us today. Give us your feedback. Send us a note. Take care. Bye.
Thanks for listening to Habitual Excellence, presented by Value Capture. We hope you'll subscribe to the podcast, and please also rate and review it in your favorite podcast directory or app. To learn more about Value Capture and how we can help your organization on this journey to habitual excellence, visit our website at www.valuecapturellc.com.